post-conference presentation, and today we'll be talking about STEMI versus chest pain by Allison Smith, Emily Manuel. What is a STEMI? A STEMI is a medical emergency. It is a full-blown heart attack. It is caused by complete blockage of a heart artery, and it needs immediate attention. The name STEMI comes from the ST elevation seen on the ECG during a heart attack. As you can see in the picture, the top ECG is normal, and the bottom one is where a STEMI is occurring. There is an elevation on the ST segment. What is chest pain? Chest pain that comes from a STEMI has typical cardiac chest pain characteristics. The relationship between pain intensity and a diagnosis of acute heart attack has not been established, but STEMI pain has often been characterized as intense pressure that radiates. More generalized symptoms of pain occur around the shoulder blades, arm, chest, jaw, left arm, or upper abdomen. Some people describe this as a clenched fist in the chest feeling. What causes chest pain? A heart attack causes irreversible death of heart muscles from prolonged lack of oxygen. When plaque collects in your arteries, it can harden over time and make your arteries narrow. This can lead to a STEMI, which then results in chest pain. As you can see in the picture, a STEMI completely blocks the bottom artery. What are other causes of chest pain? Chest pain can also be caused by gastroesophageal reflux disease, esophageal disorders, pulmonary embolism, pneumothorax, pneumonia, anxiety attacks, and multiple sclerosis. STEMI versus chest pain. So when a patient comes in and they complain of chest pain, the first thing that we're going to do is hook them up to a monitor and get IV access. As soon as we can, we're going to ask a medical history to see if they have any previous anxiety attacks or acid reflux or GERD. Our priorities are going to be the airway, breathing, and circulation. So once we hook them up to the monitor, we're going to look at the ECG to see if a STEMI is occurring or not. If it is not occurring and they still have chest pain, further interventions will be taken. Now we're going to talk about the pathophysiology of a STEMI. What happens to cause a STEMI? This starts with the gradual formation of a plaque in an artery. The plaque then ruptures and a blood clot forms on top of the ruptured plaque. This blocks blood flow in the artery. When this happens in a small artery, like the coronary artery of the heart, this causes heart cells to die because they do not get oxygen, because they are not getting blood flow. Eventually, in a STEMI, cell death will occur in all three layers of the heart, as pictured here. This causes severe heart dysfunction and causes the ST elevation seen in ECG leads facing the area of damage. Clinical manifestations of a STEMI. The main one you're going to see is pain. The patient may come in with a clenched fist over their chest and say this is the worst pain they've ever had. There are also going to be other cardiovascular manifestations, such as a high BP and heart rate initially, followed by a low blood pressure later after more damage has occurred. The patient will also have decreased blood flow to their kidneys, and as a result of that, will have low urine output. The patient will also likely have nausea and vomiting from the intense pain, and they may be running a fever from the high blood pressure and heart rate. What are the main diagnostic tests that are going to be ordered for this patient? They are an ECG, serum cardiac biomarkers, and a coronary angiography. An ECG is pictured in picture 1, and this is where you have an ST elevation in the area of damage on the heart. Serum cardiac biomarkers mean that the blood is going to be taken from the patient and run for proteins that would indicate to the doctor that a patient had a heart attack. And this is in image 2. The third test is coronary angiography, where pictures are taken of the arteries of the heart to see where the blockage is so that surgery can be done to get blood flow restored to the heart. Treatment and collaborative care. Our main priority is going to be to limit the size of damage to the heart. And to do this, the blocked artery needs to be opened within 90 minutes. This is usually done through percutaneous coronary intervention, which is a surgery where a balloon is placed in the artery to get the artery back open and blood flow restored to the heart. This is our first-line treatment. The patient will also be placed on blood thinners or anticoagulants to help prevent future clots and to help prevent the clot from growing. Our other interventions are going to center around our ABCs: airway, breathing, and circulation. We are going to make sure our patient has a patent airway, is breathing, and is getting circulation. Are they pink? Are they blue? We're going to position them upright, give them oxygen, obtain their vitals, put them on a 12-lead ECG on the monitor, make sure they have 2 patent IVs, and assess for and medicate their pain.
Our nursing priorities of care will be to manage patient pain level. We assess patient pain like from 0 to 10, so they can tell us where their pain level is. We will position patient upright and apply oxygen. We will provide our patient with nitroglycerin and morphine to reduce their pain. We will continue monitoring our patient under ECG. We will check their blood pressure, their heart rate, and their breathing changes. We will keep open IV access. We will assess heart and breath sounds for signs of early heart failure, like trouble breathing, increased heart rate, distended nerve veins. We will promote rest and comfort. We will not let our patient to go to the bathroom. We will help our patient with bedside commode. Patient teaching and education. We will teach patients measures to reduce risk factors, like checking their blood pressure daily. We will teach patients food low in sodium and saturated fat. We will teach them about vegetables, high fiber food. We will tell the patient to maintain low stress plan of exercise, like walking on a flat surface for 30 minutes. We will teach our patient to check their heart rate. We will also teach patients how to take their medications. We will tell them why they are taking their medications, and we will tell them how to take it. We will let our patients to call 911 if they are having chest pain or any other symptoms like nausea, vomiting, or dizziness. Christian caring concerns. We will maintain our patient integrity. We will use therapeutic communication with our patient. We will implement non-pharmacological comfort measures. We will acknowledge what the patient is going through, their feelings, their pain. We will help the patient identify additional support systems like their spiritual care. We will hold hands with our patients and we will pray with them. This is our reference list.
We hope you enjoyed our presentation.
Thank you.